New CDC data shows new coronavirus cases in the U.S. have dropped to the lowest levels in nearly a year as more Americans get inoculated against COVID. U.S. vaccination rates are highest in the Northeast. 5 out of 6 states in the New England area have vaccinated more than 60% of people there. But the southern states tell a very different story. Less than 40% across 6 states in the region have gotten at least one shot. The medical director and owner of First Call Medical Center, Dr. Ron Elfenbein, is joining us now to discuss this and other things related to the virus. Thanks for joining us, Doctor. So let's first look at the disparity between northern states and southern states. What do you make of that? Why do you think that is?
Yeah, it's an interesting question. I think it's multifactorial. I think part of it is, religious, part of it is cultural, part of it is political. Income related. It's just a lot of things. I think if you look at it, the northeastern states, they represent 8 out of the top 10 states in the United States with the highest vaccination rates. So it's obviously it's something cultural, and I think that again it's multifactorial. So it's not just people are afraid of the shot or people don't want to get the shot. There's a lot of issues at play here, and I think the governments of those states need to do a better job of educating their people that this is really important and that people need to get it.
Yeah, I think you're probably right. And I think it's also perhaps a factor is, just if you've had kind of personal knowledge of how challenging COVID-19 can be. New York City was locked down. People know very intimately how bad things can get. And versus, maybe for some people it's more of an academic thing. It's something they saw on TV, but they didn't see a lot of it in where they live, particularly if they live in a rural area. And that too, I'm sure, has an impact on how enthusiastic you are about getting the vaccine. But we got a lot of things to talk about. So I want to ask you about this other bit of information now about teens, some teens who received the vaccine, a very small number, but still it's worth talking about. There are a few reports of heart inflammation in vaccinated teens and young adults. The agency has not made, the CDC has not made any determination that the conditions were caused by the shot. But, when you hear this, what do you make of it?
So what you're talking about, Anne-Marie, is what's called myocarditis, which is I don't want to say common, but it is a known sort of side effect of viral infections that people get. It's very common with influenza, for example. So it's basically an inflammation of the middle layer of the heart muscle, and it causes things like shortness of breath, chest pain, fever, high heart rate, and fatigue. And they're finding that the CDC, as you mentioned, is finding that there is a small number of teens who have developed myocarditis about 4 days after getting the shot. Now, whether those two are linked or not, we don't know. We do know that the risk so far, at least based on the data that we've seen, which is very, very preliminary, I just want to emphasize that, is a lot less by getting the shot than it is from getting the infection. I mean, if you think about it, to date, we've had about 4 million kids that have been infected with COVID-19, about 16,000 hospitalizations of those children, and over 300 deaths, which makes COVID-19 one of the top 10 leading causes of death in children in the United States right now. So, yes, it's only 300. That's a small number, but it's devastating, obviously, if it's your child. And that puts it pretty high in the risk stratification for deaths from children. So right now, again, preliminarily, we know that the risk of catching COVID is much higher than the risk of getting the vaccine. So I would still encourage, as the CDC is doing, people and their children to get vaccinated.
When the Johnson & Johnson vaccine, when there were concerns about perhaps it causing blood clots in a small number of younger women, they paused the vaccine for 9 days or so. This is not something that the CDC seems to be considering. It's sort of a guess, but would it be because the risk of a blood clot could have a more dangerous outcome or more severe outcome than this heart inflammation that we're seeing in young teens?
Yeah, I think that's part of it. So myocarditis generally is self-limited. It usually goes away on its own. Occasionally people will need to be hospitalized for it. But as I said before, it's a fairly common thing that happens with other viral infections that people get. So usually it just kind of goes away on its own. I think part of it also is that, that when the government paused the Johnson & Johnson vaccine, they really undermined their credibility and people's faith in that vaccine. So I think they learned a lesson from that if they're going to pause the vaccine, they better be sure that they have a good reason to do so. And I don't think they have the data yet to do that. So I think it's probably both of those reasons that they haven't done that yet.
So listen, last summer, COVID cases dropped in some parts of the U.S., like New York City, while other places like Los Angeles saw spikes. Dr. Anthony Fauci recently suggested that the virus could become seasonal, like the flu. But could we also see COVID reemerge based on region?
Yes, absolutely. I think yes to both of those. Yes, the COVID, I don't think there's any question it will become a sort of seasonal problem that we'll have to deal with, and which, I think Pfizer, Moderna, and Johnson & Johnson are already working on generating an annual booster shot for that. But furthermore, I think specifically what we spoke about earlier with the vaccine disparity across the country, we will definitely see pockets of explosions of cases in various areas because people aren't getting vaccinated and people are, going out and the country's reopening, which is a great thing. But at the same time, unless we have herd immunity and we have enough people vaccinated, we're going to see explosions in cases. So I think that's inevitable, unfortunately.
So, of course, we know that the CDC sort of relaxed mask guidelines for fully vaccinated people. But immediately after they did that, then we all started talking about, well, how do you know someone's fully vaccinated? How can we depend on the honor system? Do you just ask them outright? And, there was a U.S. Congresswoman that suggested that asking someone, are you vaccinated, is private information. It violates federal privacy laws. You're asking about their current health condition. Health officials disagree with that, though. Can you sort of clear this up? Can you ask someone, can a business ask someone, listen, if you want to attend this concert, we got to know if you're fully vaccinated?
Absolutely. So I think what people are misconstruing is the HIPAA law, which is the Health Information, Health Insurance Portability and Accountability Act. And that only applies to covered entities. And covered entities is somebody like myself as a physician, or your doctor's office, your insurance carrier, the people that do business with your doctor and your insurance carrier. But your cousin can certainly talk about your health care. That does not violate HIPAA. That might be a nasty thing to do, but that's not a HIPAA violation. And your employer can certainly ask you. You can choose whether or not to answer, but anybody can ask you that question. Absolutely. Hey, Anne Marie, have you been vaccinated? You can choose to answer whether you want to or not. That's not a HIPAA violation. But it's a HIPAA violation if I tell somebody you've been vaccinated or not as your doctor. But people asking you definitely does not violate HIPAA in any way, shape, or form. There's no federal law that is violated that way. Now there might be some state laws, so people would need to be careful about what their state's laws are. But as far as federal law, no, there's no violation of federal law at all. And businesses are certainly free to ask that. And I think they probably will.
I did not know that. Dr. Ron Elfenbein, I learned something new from you. Well, every time you talk to us, I learn something from you, but thank you so much.
Thanks. Thank you, Emery. Have a great day.